Good afternoon. My name is Shayla Arauz and Krisia Menendez, and we are here to teach you about a gastric bypass. A gastric bypass is a surgery that changes how your stomach and small intestine handles the food you consume. In other words, it's a surgery that makes your stomach smaller and therefore you will feel full with less food, causing you to lose weight. There are many reasons why a gastric bypass surgery is performed. It can be because of unusual reasons such as type 2 diabetes, hypertension, or sleep apnea. But the most frequent reason people get a gastric bypass surgery is to treat the morbid obesity. Before qualifying for a gastric bypass, many doctors use what is called a BMI index. Now, this is an index chart that tells you your BMI, your body mass index, depending on your height and your weight. This is something that they take into consideration and determine which people are most likely to benefit from what is known as the weight loss surgery. As you can see here, I put a picture of a preoperative normal stomach, and then you can see a postoperative stomach. You see how they made an incision through the stomach, making it smaller, connecting it to a small intestine. The way they perform the surgery is first, they make a small stomach pouch, and it's created by dividing the top of the stomach from the rest of the stomach. Next, what they do is they get a portion of the small intestine, and the bottom end of the divided small intestine is brought up and connected to a newly created small stomach pouch. And the procedure is completed by connecting the top portion of the divided small intestine to the small intestine further down. There are some requirements with the gastric bypass surgery, such as exercise and diet. But we're going to focus first on the exercise requirements. Exercise is encouraged to begin 2 weeks after a gastric bypass surgery. Mainly walking, running, biking, weightlifting, aerobics, hiking. Any exercise, at least 30 minutes a day, 5 to 7 days a week. With every surgical procedure, there are some things to take into consideration. It's very important to understand the surgical process and what to expect afterwards. It's important to talk to people who have had surgery for obesity. Start a journal about the experience as well, or get your family to write you a letter of support. Start planning goals and reasons why this will be a very effective surgery and why you need it. It's very important to take a multivitamin each day, unless you're allergic to or your doctor recommends you not to. A complete physical exam is necessary as well, just to make sure everything is the way it should be. Blood test, ultrasound of your gallbladder is very important, as this will have a lot to do with the abdominal area. And nutritional counseling will be required, pre-operative and post-operative. So as you can see here, I added a diet requirement. These are your requirements for the next 6 weeks after surgery. It's very imperative to follow these guidelines because this is a very effective and successful surgery. And it is up to you to maintain the effect for the rest of your life. Of course, there are some risks with any surgery, and the risk with a bypass surgery could be anesthetic or gastric bypass risk. You can see you can have an allergic reaction to a medication, Or you can develop gastritis, heartburn, or stomach ulcers. You can even have leakage from the line where parts of the stomach have been stapled together. So it's very important to fully understand the way this surgery works and what to expect. And in conclusion, I would like to mention that a gastric bypass surgery is a successful weight loss surgery. You will lose up to 70% of your excessive weight, but it is up to yourself to maintain the weight off for the remainder of your life by understanding the risks, completing the exercise requirements, following the diet requirements, and fully understand why this gastric bypass surgery was performed in the first place. It is not the same for everyone, and we all have different body types, and we all handle our diets differently. But it's very important to keep the weight off, and this will definitely be a life-changing surgery. You will have a reduction in medications, you'll become a healthier individual and live a longer and happier life.